If you are watching this video, you're probably interested in LASIK and have astigmatism, farsightedness, nearsightedness, or possibly wear glasses for reading. Those people that are interested in LASIK usually have three main questions. I'm Dr. Jerry Maida, the surgeon at Maida Custom Vision, and I would like to address those three questions. The first question is it safe, and what is involved with this treatment? Well, the procedure is called LASIK. A flap is prepared in the cornea, and the treatment is done on the inner surface of the cornea. The flap is created with a handheld instrument known as a microkeratome. This instrument uses an oscillating razor blade. The surgery has been safe, but on occasion can have complications, some which are sight-threatening. An innovation on that treatment was the utilization of a laser instead of the blade. It is bladeless surgery. We presently use an intralase and have used it in this practice for about 9 years. We have had no serious complications in that period of time. With the intralase, the surgery is uniquely safe, precise, and predictable. Then once the flap is created, the flap is lifted. Then the Allegretto wavefront optimized laser is utilized to reshape the surface, reshape the cornea. That laser is accurate to 1/4 of a millionth of an inch. Patients often worry about their eye moving. Well, the Allegretto laser tracks eye movements 200 times a second, so patients do not have to worry about the eye moving. Also, it treats based on the curvature of the cornea, which alleviates problems with glare and halos. Once that is complete, the flap is replaced and begins sealing down immediately like Velcro. Because the surface of the cornea is not touched or treated, patients can actually see well that day, and 80 to 90% of our patients can drive back to work the next morning or back into our office. The second question is, how do you pick a surgeon? We feel the things that are important to picking a surgeon are to pick someone with a great deal of experience, and we have done over 20,000 laser cases. I think it's good to pick someone who specializes in that procedure and performs it 5 days a week. Also, the staff can be critical. It's good to have a long-term staff that cuts down on any type of problems that you may have, and also the staff that's focused on patient service and customer service. That is actually one of the things that separates one office from another. I think one of the most important things is to pick a surgeon that is comfortable treating his own family or treating other eye doctors. And in our practice, we have done many other eye doctors and their families. That's important because other eye doctors actually see the results and know who to go to. The third question is, how do I know what's best for me and what I should do? Well, when a patient comes to our office, we spend 2.5 hours examining them. We do a refraction, dilated exam, and scans. The scans measure the shape of the cornea in millionths of an inch and determine if the surgery will be safe or not. Also, we do a medical history. Occasionally, patients with uncontrolled diabetes or rheumatoid arthritis are not candidates for the treatment. In addition, occasionally there are certain medications that preclude a safe treatment, such as Accutone, which is used for acne. Once we have all this information, we let the patient know if they're a candidate or not and what procedure is best for them. Then those patients can decide, do they want to live a life without glasses or contacts? If you have further questions, you can call us at 268-EYES, that's 268-3937, or look at our website, which is maidalaser.com.